consistently so that messaging is clear on disease risks to humans related to animal populations, that the right stakeholders are at the table to inform that messaging, and that it's really consistent throughout. Community involvement. This is, of course, crucial for the humanitarian sector, and there's a lot of important knowledge and networks. And the One Health approach can really help us to advocate for zoonotic disease risk reduction, whether it's at national level, subnational level, community level, when designing practices and policies. And then the last really key area for a One Health approach is coordination structures. We all know the challenges of coordination, especially in an emergency situation where you have to do things very quickly. And it's challenging to coordinate with the other sectors to identify and manage risks and where to fit into that management approach. So we'll be talking about where One Health approaches can come into these 4 key areas. You can see the headers on the slides that will follow, but I just want to point out that a lot of these are cross-cutting. So we're often talking about approaches that kind of address multiple areas of focus with a One Health approach. Now, when we think about moving toward prevention, or so that we can better respond, in a more timely way, that we can really be ready for these outbreaks that we're seeing, and we can move upstream to mitigate risk and impact. This figure, I think, is a helpful framework for understanding what happens before the outbreak occurs in humans. So we see here the area in red. This is when we see an outbreak in humans. But of course, if it's a zoonotic disease, something that comes from transmission from animals, there's this whole process that happens before. So we see here in blue the domestic animal amplification. It could also be from wildlife, where you see direct spillover from wildlife or vectors such as mosquitoes to humans. And this lead time, by looking upstream, looking at what's happening with the ecological factors, the human factors that are shaping risk of spillover. And then we see, once it's in the red area, we're forced to respond. So I think we really want to move ahead of this huge amplification where you see the spike in cases. And it's really about moving upstream in the process so that we can be ready to respond both to outbreaks and also threats upstream. Now, I think there's a really important role for mapping and identifying areas of vulnerability. Catherine Newell will show the dashboard that she's been working on that really shows how we can use mapping in very practical ways to understand the things that we do need to be prepared for and responding to. I think this is important here in terms of targeting where we can be on alert. So we're working in many of these countries that we see are the hotspots for disease emergence. You can see here the areas in yellow on the map to the left. These are hotspots for emerging infectious diseases for wild animals. You can see also, of course, these countries are often areas where there's a lot of land use change happening very rapidly, a lot of contact with wildlife, with animals. And so situations are changing and dependencies on the environment are changing. And there's also urban growth, there's migration, and often there isn't an adequate public health system that can really be preventing and quickly detecting new pathogens emerging. So there's that crucial role of readiness, where we can be identifying the areas of vulnerability, preparing adequately, and being ready to respond. I also want to show, this is also an opportunity for known diseases. So here on the right, you see canine leptospirosis. Leptospirosis, of course, we see often as a consequence of flooding events. It's a zoonotic disease as well, so humans are affected, as well as other species. And you can see that we can predict based on relative risk. So again, in red here, you see certain counties have increased likelihood of having canine leptospirosis. So this allows us to really target our resources. We may not have the ability to detect every case, but you sort of know where you should be looking, and you should be able to prepare and respond. Now, for a One Health approach, when we talk about managing risk and burden, context really matters. So I think there's this tendency when we hear One Health and the different sectors, that it would mean that everyone has to be working together all the time. But of course, that's not the case. So it's really finding those areas of value to work together. But in order to do that, we need to make sure that the systems are in place to be able to determine what the relevant sectors are for a given objective, disease, or situation. So strengthening the sectors so that they can come together and work in a really opportune way that's value added, and find those correct entry points. The entry points can really vary based on, if you're working on prevention, detection, response, or recovery. We'll look more at that in this presentation. But the goal is, of course, to promote resilience, to promote effective recovery, and it can be both from direct and indirect impacts. And of course, we know that in a given epidemic, you have the health impacts, but you also, of course, have the economic impacts, the food security impacts, the changing daily exposures, just because we have to change our practices, whether it's because of forced quarantine, whether it's because of lockdown situations, and all of the suite of cascading effects that can occur from an epidemic. So it's that readiness to respond to both direct and indirect impacts. I want to show here again the Venn diagram. We saw that first one earlier where the circles were equal for human, animals, and environment. But of course, based on the context that you're working in, the given objective, the disease, the situation, the country, based on the transmission factors for a given disease, you may have a totally different situation. I'll just give the example here for Nipah virus, which we'll hear more about in Catherine's presentation later. But there's no therapeutic for Nipah virus. This is a bat to human disease. You can also have a livestock role where there's this huge amplification event in livestock, and there's this burden to the livestock sector and food security and livelihoods. But because there's no human therapeutic, you're sort of really left to work upstream and mitigate the risk. And then, if you do have the human cases, work downstream and mitigate the human consequences. So again, the entry points vary based on your context, your disease or situation, but it's that finding those right entry points that are really cost effective and value added. Now, it's also about avoiding unintended consequences. We've heard about avian influenza outbreaks. They can be very, very detrimental, especially at local levels, at regional levels. And wild birds are the natural reservoir for avian influenza viruses. They have incredible genetic diversity. And these are typically low pathogenic strains, so not a risk to humans. The concern is when you get this mixing with domestic birds and you have potential for change in these viruses that makes them really transmissible, and you have these major events in domestic poultry, and of course impacts on food security, on livelihoods, the whole value chain. Biosecurity is very important. So we have benefit of ecological information, environmental information, where we think about where we're developing livestock systems. But let's see then when we do have these outbreak events, without effective coordination, response measures can be incorrectly targeted. These are, of course, an inefficient use of resources when these are incorrectly targeted and they don't address the problem. They actually may cause other problems. So we've seen in the past with avian influenza outbreaks that there are these inappropriate response measures, such as killing of wild birds, some endangered species, bleaching of wetlands and lakes. And of course, when you do this, you have many downstream impacts. Sorry for the echo here. Sorry for the technical challenge. And we see that, of course, this has many impacts when you affect these ecosystems in a way that the people, the communities living around those ecosystems, those will have long-term consequences when you do disrupt those ecosystem services. So it's really important to have that consistent communication. We need partners from conservation communities, from human and animal health, from food and livelihood security, risk communication, and local leaders, of course, to have coherent messaging, to make sure that we're putting into a place appropriate control strategies that really address the source of the issue and minimize unintended consequences. Now, I'll just talk about, again, the role of mapping, the benefits of mapping. So when we think about managing impacts of disaster events, we can see here El Nino cycles, we are able to predict these with relatively good frequency about where we'll see specific effects. So you can see the arrows here looking at, specific consequences in some areas, increasing flooding events, in others, drought events. We could see something like increased risk of Rift Valley fever outbreaks where we have a direct health event that will have an impact on livestock, potentially on humans. It's a zoonotic disease. But then if we also look at areas of drought, we can think about how people are likely to move. And of course, when people move, they move with their animals. So you're likely to see this movement of people, and then the animals going with them, and they may or may not be vaccinated. They may be facing new exposures. So you have this potential for changing exposures and disease introduction. So we need to be prepared for these human migration events, the One Health considerations that we can really use to be able to predict and really be able to be ready to respond. Now, I'll just show here, we may look at this and think, oh, this is a human clinic, and we're testing human patients coming in, whether it's for Ebola or other diseases. This was actually our field team in Liberia sampling bats. So bats and rodents and others, and looking for, the known pathogens, but also pathogens on the horizon that can emerge. So just want to give the point that, when there is a response and you're looking at what's happening in the human population, you also have to be considering what's happening in the animal population. And One Health surveillance is a crucial tool so we can rule in and rule out a potentially continuing source of risk, and be able to know how to target our interventions, our change in practices. Of course, when we're doing this sampling, you can't just go into a community wearing your Tyvek suit and expect to be welcomed. You really have to work with the community, make sure that they understand why you're there, understand, that they're really part of this risk preparedness and readiness process. I think it's really important too, when we think about community entry points, some of these may look very familiar in terms of local leaders, youth leaders, reaching different communities and audiences, but also livestock officers, regional foresters, or park wardens, which, these may be the frontline workers in terms of health exposures from wild animals, from livestock, and we really need to be working with them as well to understand the full picture. And of course, we can work then to reduce our risk. And this is a great example about living safely with bats. So once we do the field sampling, working with communities and the biological aspect of One Health surveillance, we can also work with communities to raise awareness. So this is a great tool, living safely with bats. Talking about the benefits of bats, they're very important for ecosystems and pollination and food security. But what do you do if you do see a dead bat, next to your home? How do you safely respond to that situation? So again, it's that coordinated outreach and making sure that we're working with communities and having those honest conversations about reducing risk and making sure that we're ready to respond. Now, a great tool here in terms of, these practical challenges about working in countries where there are many sectors at the table, different regulations and mandates, different capacities, different types of plans, programs, and systems. It's really hard to find, where do we fit in, especially when we're talking about a response phase, non-governmental agencies, and that landscape of actors, and finding where we can best align with existing work and really add in additional needed resources. This intentional coordination is really crucial, and that's what these national One Health platforms are helping to do. They're helping to make coordination routine, bring partners together more frequently, have dialogues about shared priorities and entry points. You can see here this One Health governance structure. This is an example from our colleagues in Uganda that developed this One Health strategic plan. There are many partners at the table. So health, environment, wildlife, livestock, and of course, disaster management. So bringing together these different stakeholders and finding really how do we optimize resources so we can prevent, detect, and respond and recover effectively. So I'll just close here before handing over to my colleague. If you're looking to learn more about One Health operational guidance and tools and resources, the One Health operational framework developed by the World Bank with colleagues at EcoHealth Alliance and many others, it's a great resource. There's a lot of guidance from it. And I think this figure in chapter 5, which talks about these different domains, the mapping of stakeholders, roles, responsibilities, financial and personnel resources, communication and information technical infrastructure and governance, sort of the different aspects of this and the key opportunities to intervene. And I think this is really exciting here because there may be some that are very familiar to us that the humanitarian sector does very well, population specific and sensitive messaging, for example. That's really crucial. And identifying vulnerable populations, that's something that the animal and environmental health experts are not, they're not trained in doing that. So I think it's really crucial to sync up. And then there may be some other facets here that are not as familiar to us. So things like the role of wildlife disease experts, so I think it's finding that coordination that can allow us to really prevent, detect, respond, and recover, so we're ready for these epidemic concerns. Now I'll hand it over to Dr. Karish. I just want to say he's very humble, but he is actually the pioneer who came up with the term One Health. So you'll get to hear from the person who coined the term. So over to you, Dr. Karish. Thank you.
Oh, thank you so much. And greetings, everyone. I just was going to reiterate a few of the things that Dr. Machalaba just went over. Thank you, Catherine. That was great. Just some real kind of real world examples on what we found and about the value of coordination. So this is an example courtesy of the Harris County Public Health. This is a group out of Harris County in Texas. And they've been recently talking about how they've been integrating One Health into their their general approach. And they have a little before and after kind of diagram what they did and how they used to be segregated into different sections. On the clinical medicine and public health side, they would follow their test results and kind of use humans as a sentinel of disease emergence and disease outbreaks at a local level. They had mosquito control, and then they had their sanitation department and their animal control department, and they all worked independently and didn't share information. When they started doing integration, what they found out was on a daily basis, they kind of really put readiness into practice. They were kind of ready every day because they were sharing information across these three typically siloed units or functional units in the county instead of sharing, and they would kind of catch up later and tell each other, oh yeah, we saw that problem a few months ago. So when they put that into their kind of readiness, for daily operations, they started linking that information with each other and could really actually move forward and either respond faster or actually implement prevention in there so they could reduce disease emergence and burden of disease. The bigger examples, of course, we use Ebola a lot. And if you go to the next slide, we can kind of always think about this, after the response, and people kind of wonder like, well, once these diseases emerge and they become human to human, so they start out in animals, become human to human, the horses are out of the barn, it's too late to work together, let's just focus on the people. But there's a lot of ancillary angst and confusion that goes along with that. We've seen that with COVID-19. Early on with Ebola, we see it repeatedly with outbreaks because information comes out that, oh, Ebola comes from bats or Ebola is in pigs. And then there's a panic and really poor risk communications across sectors. Is it safe to eat pork? Is it safe to eat chicken with avian influenza? We had governments actually making recommendations not to use chicken bouillon cubes because you might get avian influenza. So we really have to kind of bring those sectors together. Of course, part of that's preparedness, but more than that, it's really operate at that operational side about really being ready to reach out right at the start of any kind of these outbreaks as you're getting your response ready. You also have this coordinated risk communication and across the different sectors. So you have to pull in the different groups from different areas of expertise. So next slide. So this is kind of the original of what Catherine showed you before about doing some engaging other communities or other sectors of society. We've seen it repeatedly with Ebola outbreaks. If you are looking, you can start to see the disease in animals, particularly in wildlife, before you get human cases. So what can you do about that? Well, part of that readiness is bringing those different sectors of society, in particular here, the wildlife sector, the national parks. But the next slide, please. But in addition to that, it's really the local people that are out there every day in contact with the wildlife. and with animals and living off the land. So you have subsistence hunters, but also farmers, smallholders, and they're kind of the eyes and ears of what's going on in the world. So we typically think we need to reach out to these communities after the outbreak and explain diseases. And of course, we want to do that. But one thing the humanitarian aid sector and other sectors, the conservation sectors, the environment sectors, there are quite a few, is they're there operating all year round. So you build a relationship with local communities. It's not you're just coming in for the outbreak. As soon as the outbreak is over, you leave. That's been done for decades with Ebola. You have the international teams come in, the outbreak's controlled, everyone leaves. Local communities still are wondering what really happened, and they're confused about it, and they don't know how to protect themselves. So part of this is engaging them. In the cases of Ebola, we now have local communities acting as the frontline sentinels. And if they see changes in wildlife populations, they report it to authorities, and there's immediate response, and an outreach starts immediately with risk communications about the risk of Ebola outbreaks happening. That's the perfect scenario. So we want to utilize our engagement across sectors with the different parts of government, but also with different parts of local communities, and get them all engaged in this readiness process. And I think I'll wrap it up with that. And we'll move on because we have another tool that we wanted to show you. And this is going to be a discussion with Emma and our other Catherine to talk about this dashboard as another way to really get people, the different sectors engaged. So on a daily basis, like that Harris County example, on a daily basis, they're really ready to respond. Over to you two.
Thank you so much for that really informative presentation. And we'll come back to you for questions at the end. But firstly, I'm just going to spend a bit of time with Catherine. Just to a note to the participants, please keep putting questions into the chat box and we'll come to those at the end. But Catherine, welcome and thank you for joining us. And a big thank you too, because I know that you, together with your EcoHealth Alliance colleagues, have managed to create a draft prototype of a One Health data dashboard in order to help your humanitarian colleagues be more ready to detect potential occurrences of disease. I've seen it, I think it's great, and we will share it now in the chat box with the audience so they can have a look at it in its real and entire form, with the caveat that it's a draft, so some of the links are not live. Just so people know, the link will no longer function at the end of the webinar, so make sure you have a play around now without being too distracted while Catherine explains what she's created here. Catherine, I gather for the purpose of this webinar, you're going to show us a presentation which extracts from areas of this dashboard in more detail. So we're all ready. Can you walk us through it?
Sure, thanks, Emma. So as an epidemiologist, I became aware of just how much we tend to segregate animal, human, and environmental health. Currently, there is a gap where nobody is really forcing us to come together on the ground until it's too late. And we must engage reactively when we're faced with things like disease outbreaks or environmental damage, or things like drought or food security. So we wanted to know, is there a way for humanitarian organizations and local staff to be more prepared to proactively fill the gap required to achieve this One Health approach?
Oh, sorry, I'm having problems moving the screen. Yeah, there you go.
Yeah, thanks, Emma. So this led me to collaborate with the Ready initiative in designing basically a prototype of a One Health data dashboard for Bangladesh. We aim to explore what data was out there that could be utilized effectively and would allow us to bring a One Health component into preparedness, surveillance, and response. And these are some of the data sources that we have used, which I will go through in detail during this presentation. As Catherine has mentioned, by acknowledging the One Health approach to health, it could also help us improve things like targeted threat assessment, risk mitigation measures, as well as control measures, including risk communication and community engagement, and also enable more efficient planning and resource mobilization for improved outbreak preparedness. So let's start with preparedness and readiness. Let's say you're working in Bangladesh. What do we want to know if we're going to apply a One Health approach to inform population preparedness to, say, infectious disease outbreaks? Well, firstly, we should have an idea of what diseases currently exist in humans, but also in animals in Bangladesh. And this is what this shows. It's the animal health situation from the World Organization for Animal Health, for Bangladesh specifically, showing the diseases, or showing some of the diseases found in both domestic and wild animals, whether or not they can transmit to humans, as well as their severity in humans, and severity here meaning the proportion of cases which end in severe disease or death, red indicating the most and green the least severe. What this dashboard also does is it allows what we want to know for preparedness and readiness, which are things like, how likely are we to encounter this disease in humans? What are the common symptoms in both humans, but also in animals, and their severity? And so it allows you to click on certain diseases, and then it provides you with this information in English and in Bangla. So some other factors that might inform preparedness and readiness are things like animal density. This is important because if an animal contracts a disease in an area where a lot of other animals are present, this disease will likely spread a lot faster, and risk of it transmitting into humans, if it's a zoonotic disease, may be a lot higher. So this part of the dashboard allows you to explore the number of animals per square kilometre by district in Bangladesh, and that's what this map shows. It also lets you create district-specific risk communication and community engagement type messaging that's in this case not specifically tailored to animal or human health, but that acknowledges the interconnectedness that can be used to inform populations not just to the risk of specific zoonotic diseases, but to the concept of One Health in general. It's useful for us to have at least an idea of, for example, how many livestock animals are found in the district in which you're working. If there's an outbreak of a zoonotic disease in chickens, for example, and you're in a district of Bangladesh that has a very high chicken density, you may wish to alert the population you're working with to the risks as well as the possible prevention measures. Another area where we can incorporate One Health into preparedness is to examine things like agricultural stress. This is an indicator that's used to identify land with a high amount of crop damage due to drought. And you can see here what crops with high and low agricultural stress tend to look like. We know that drought increases susceptibility to many infectious diseases like cholera and E. coli, as well as many more. So it's useful to know, is the area I am working in experiencing high levels of agricultural stress, or has it in the past 6 months, for example? In some areas where we work, this may be very obvious, but in others not so much, particularly if it's in an area where we have not worked previously. And these are some of the types of diseases we may see an increase in Bangladesh specifically, because of this environmental stress. If we are prepared and can implement prevention measures early, it makes preventing an outbreak a lot easier. We also looked at changes in land use. And what this shows is districts that have had large amounts of deforestation, so chopping down a lot of trees, shown here in the map in red. We know that many diseases are found in forest habitats, but also many pathogens that we are yet to encounter. As deforestation occurs, humans come into more contact with animals, potentially carrying those pathogens we wouldn't normally be exposed to. In countries like Bangladesh, this is also combined with rapid population growth, making this contact even more likely. Again, in some places we work, it will be obvious that deforestation has occurred, but in others it might not be. If we don't even know about it, let alone the magnitude of it, we can't begin to prepare for the potential effects on the health of the populations we serve. This is some data from some research that was done in Bangladesh specifically, but most countries will have some data on land use. It's worth looking at this and becoming familiar as we do things like secondary data review before we start an assessment. And here's just an example of how a dashboard like this can create the types of targeted alerts you may want to use with the population you're working with, alerting them to just a few of the health risks that are linked to deforestation in the areas you are working specifically.
Catherine, this is great, and thank you for explaining how we can use this dashboard to help us think about readiness. How else do you think we could begin to use this One Health dashboard in practice?
well, if you just go on to the next slide. Yeah, so these are some sources of surveillance data that, when examined from a One Health perspective, can provide useful information for humanitarian organizations working on the ground. Influenza A is a disease of pandemic potential, and because of this, most countries have some kind of human influenza surveillance system. This is a snapshot of epidemiological information from the Bangladesh National Influenza Surveillance System, and it monitors monthly counts of laboratory confirmed influenza A cases, showing which districts have the highest number of cases, that's what the map here shows, and also some specific subtypes by region. Next slide.
It's coming.
It's okay. Yeah, so say you're working in a district of Bangladesh that has a very high rate of influenza A. It's important that risk messaging is not just done from the silo of human health, but rather we use targeted messaging that acknowledges the One Health component of this disease, effectively showing people, yes, the normal epidemiological information to inform preparedness and readiness, but also how to spot influenza A in both humans and animals. And for animals, in some cases, this may include their own livestock. So also things like who should they be reporting it to? Finally, then, this section presents alerts from the Programme for Monitoring Emerging Diseases, which conducts global reporting of disease alerts in humans, animals, and plants. These are real-time alerts which inform us of important emerging pathogens and diseases. We should, at the very least, be aware of these, if not monitoring them as humanitarian organizations, and not just for human diseases, but also for animal and environmental alerts. If there's a reported case of rabies in a dog in the district in which you're working, for example, can you ensure that you and the communities you work with will receive that information? And are we able to get across to the populations we serve why it matters and the prevention measures they should use to prevent any disease transmission? As we learned from outbreaks like the West African Ebola outbreak, community engagement is crucial in effective outbreak response. This dashboard then collates the alerts by district for animal and human diseases. And then using these sections, you can design your own sort of targeted risk communication and community engagement type messaging from a One Health perspective.
Catherine, thank you so much. So, I mean, on reflection, I think the main takeaway points for our humanitarian colleagues today are that understanding the connection between humans, animals, and the environment helps us to proactively prevent, detect, and be ready to respond to disease occurrences. But there's still work to be done to manage the risk and burden. We've learned today that we have national One Health coordination platforms and key operational resources, as Catherine and Billy have mentioned, but we need greater integration of One Health data tools to aid with readiness, things like this dashboard. Have you thought about how we can begin to apply this dashboard in the humanitarian sector? Who could be responsible for implementing One Health readiness using the information in this dashboard?
So the way I see it, this type of data has the potential to be incorporated as part of the package of public health information services that the health cluster should uphold during a humanitarian response. For example, it could be part of the public health situation analysis. The public health situation analysis is basically part of the assessment that the cluster produces at the start of a health response to basically understand the public health situation and inform the evidence base that is needed for the collective humanitarian health response. We should gather and assess these types of One Health information when we engage in a humanitarian response to give us an idea of what to expect, the same way we do for other health threats. I also expect as things like population growth, deforestation, biodiversity loss increase, there will reach a point where we're going to have to operationalize a One Health response into our response in the humanitarian sector, whether it's emerging zoonotic disease from continued deforestation, or during the next spillover event of a new pathogen, or even in conflict-based situations where veterinary care diminishes quicker and tends to be re-established slower than human care, so we may see a rise in zoonotic disease. the quicker we can get on board with incorporating the overlap between animal, human, and environmental health, I think the more we will be able to provide to the populations we serve as these entities grow closer together. I'm not saying that everybody who works in the humanitarian sector should go off and learn about the clinical presentation of disease in cows, for example, but rather we as a sector need to be open to the idea of incorporating One Health at this ground level and aware of some of the data sources that might help to facilitate this.
Thank you, Catherine. That was an amazing presentation. I know how much work you put into it. It's been really informative, and it seems to me that this is something that different humanitarian agencies should be aware of and trying to incorporate into their work. I'm now going to invite Billy and Catherine back into the room. I'd also like to invite the audience to ask any questions that they might have in the chat box if they haven't already. I know I have a few questions for you all. Perhaps while the audience are typing questions and I quickly try and scan the box, I might just start things off. Catherine, can I ask you a question? Do you think this is something that could pick up the next pandemic?
That's me, isn't it? Not Catherine.
Sorry.
Yeah, sorry, Catherine. So, I mean, this dashboard alone, probably not. But what it represents, and I think what it's paving the way for, which is the opening of the One Health dialogue across sectors, that I think potentially can. Following COVID-19, we're hearing a lot about the requirement for things like global risk-based viral surveillance networks and early warning systems to detect new viral spillover. But to be truly effective in potentially preventing the next pandemic, we must also have types of bottom-up inclusion of NGO and operational staff and local populations, as Catherine mentioned, who are likely to be exposed to these pathogens of pandemic potential and whose early actions and response could potentially help mitigate a future pandemic. I don't know if Catherine or Billy have anything to add.
No, thanks, Catherine. So I might ask Billy and Catherine a question. How does antimicrobial resistance or antimicrobial consumption factor into the One Health approach for disease preparedness? If I've read that out correctly. Do you want me to read that question again?
No, but I would defer to Catherine because she's leading a really great project with AMR right now in One Health.
So it definitely fits in the scope. You know, we talked a lot about epidemic risk here, and you know, I think there's a wide scope for what the One Health approach can address. So definitely AMR is included. It's sort of on the downstream, you know, aspects when we talk about infection prevention and control. It's of course, you know, really looking at how do we control the consequences of epidemics and what they can lead to. So I think it falls under the umbrella. And, you know, thanks for raising it because it is a really important challenge when we talk about infections. Thanks.
Okay, thanks, Catherine. How do you think the One Health approach helps local NGOs to prepare for major diseases in countries like Somalia, for example? What sort of capacity building can be done for local implementing partners? I don't know if Billy, you want to take that?
I'm happy to start out. I think this is a really good point, and our findings from, you know, really putting this to use in country levels is that, you know, One Health is, we talk a lot about it between, you know, multilateral organizations and the international organizations, and getting them coordinated and thinking about One Health is great. But where the rubber hits the road is really out in the field and at the country level. And that's where local NGOs and national NGOs can really get engaged. So I think that's where it can have the big impact. Maybe that Harris County is a government kind of example of it, but similarly with NGOs working at national levels is already getting engaged with each other, knowing who they can call, who's doing what, who's already someplace. I showed that, you know, in that engaging local communities, you know, one NGO might have a really great network with local communities and others do not. And so being able to utilize each other's resources. One thing about One Health is it can be so cost effective and so inexpensive. Part of, you know, the great synergies can be done with some conference calls and talking to each other on a regular basis and getting to know each other. That doesn't cost a lot of money, but you really, you know, expand your reach and your capabilities by having those partnerships and relationships established, so you are actually ready to work together because you know each other, you know each other's skill sets, you know each other's needs and how you can help each other.
Thanks, Billy. And any other tips for how NGO colleagues can advocate for in-country for use of a One Health strategy? And I don't know if Billy or Catherine want to answer that.
Catherine, would you like to take that?
You know, I think that if there's a One Health coordination platform available, and I think for most countries, this is really becoming best practice, and these coordination platforms are at different stages. So some of them are just sort of being formed right now, and you may have a local champion who is bringing together stakeholders, or you may have something with an official governance manual and, you know, very high level political support. But I think linking up with those groups that are kind of getting that moving and finding, you know, what is the coordination structure? How does the NGO community fit in? Is there a formal role for bringing NGO communities? I think that's sometimes a overlooked aspect about where the NGOs fit in, you know, into actually the upstream coordination and the readiness. So I think it's syncing up there and making that coordination platform and all those partners aware. You often have ministries of education involved, or, you know, approach to be involved, and disaster managers involved. So I think finding the awareness, creating the awareness to make sure that each sector kind of understands the role of the other sectors. I think the humanitarian sector has such a great view of some of those other sectors that we don't think about so much, like, you know, the role of anthropology and effective risk communication. That again is not usually the expertise of the environmental and animal health authorities. You know, they may have some expertise, but I think the really on the ground knowledge and networks, that's something so unique that the humanitarian sector brings and can bring to those coordination platforms for a lot of benefit. It's a great question. Yeah, thank you.
Okay. And just one more question about coordination. Have you, what are the main challenges you can think of that are observed with coordination structures at the local level? Are there any that you can think of immediately?
Billy, do you want to?
No, go ahead.
I'll just say, you know, it really is context specific. So it depends on who the local actors are, where the trust is, who has the best entry point. So that varies from one village to another, from one country to another. So it's really, you know, using the strategy about working with the right partners. And I think the One Health approach just reminds us that there might be additional right partners that we need to not forget about and really actively coordinate with.
Yeah, and I would just add to that. I mean, as you said, it's very context specific, or the diversity of challenges is a beautiful thing. It's like the diversity of life. So in very resource-rich countries, you know, some of the biggest challenges are the different sectors have so many resources, they prefer to do everything themselves rather than working across sectors with each other. So you end up with a lot of duplication and reluctance to share budgets or cede authority, or it's a perception of ceding authority. In really low resource settings, you might have that just some of the basic skills are missing completely. And so then you have to really identify those gaps and come together to help. So let's say you're kind of, you know, I guess from the wildlife world, we have some old examples where you have like measles or infecting rare conservation species that brings a lot of money in for tourism and stimulates the economy. And the best approach to protecting them would be to vaccinate children for measles, not the animals themselves. So, you know, you need to have the resources there, and you need to be able to work together, and you need to advocate for each other and not just fight with each other about who gets the resources, but actually work together and support each other, because everybody has something to contribute there. So we have to kind of, we see One Health as kind of three legs of a stool. So it's the human side and the domestic animal and food production side. And then there's an environment side that we see, including wildlife. And if you don't have all three legs there working together and connected, of course, then you don't have a stool that stands up. So the challenges come from different reasons, but you really need all these components working together.
Okay. Thanks, Willie. A slightly different question. Have you encountered or do you anticipate encountering challenges with communities hesitant to report diseases in their own livestock for fear of punishment or stigma?
Yeah, well, that's certainly a challenge. And then so there's a lot of discussion about compensation strategies, and that varies from country to country. It really also depends on who's taking financial responsibility for some of that work. And medical services, veterinary services, they're handled differently in different countries. In the United States, those are considered part of the private sector, and private owners are taking the risk and they get to keep the profits. In other countries, some of those services are provided by government. So it's a shift there. So once again, it's very kind of context specific. All of them require really good relationships though with the local communities and local people. So you understand what their challenges are. So they get to feel like they're not just a victim of these outbreaks, and then the victim, then next to victim of the policies that result from the outbreak, but they're actually participatory in what the solutions are. And as I say, if you're not part of the problem, it's actually it's hard to be part of the solution. So really the people that are challenged with this can contribute a lot to that solution. Once again, I think the humanitarian world has those kind of more ongoing relationships with communities and has built that trust. So there's an amazing opportunity to bring that information in.
Yeah. Well, one more question for you, Billy. So usually human, animal and environmental health all exist in different ministries at the national level. Is there a good example from one or two countries that you know of where these ministries have worked really well together and adopted a One Health approach?
Yes, and I think that came from someone in Indonesia. And Indonesia's actually had some very great kind of early on experiments with building some national kind of One Health platforms about integrating the different ministries that could potentially be involved. Some of that is, waxed and waned depending on funding for that. In other countries, we see in Liberia, the vice president of the country has kind of gotten very excited about it and has jumped in, and their national One Health platform meets on a regular basis, and the vice president leads that group. So everybody tends to want to participate and listen. And whether or not they're responding or getting prepared, I think I look at that as that relationship building is really about being ready to work together at any minute's notice. They know each other, they share information about what problems they're having. They already know that, they're aware of that before, so they really know how to utilize each other. So it really varies between countries, but we see it in many countries around the world where there's really active engagement, sometimes led by the NGO community, sometimes led by government.
Okay. Thanks. I just want to give Catherine Newell the opportunity, just one very quick 1 minute answer to this question if you can, but any tips on how you might go about drafting One Health proposals with country teams or incorporating them into program implementation?
I mean, sure. So there's kind of like two approaches that you can, I suppose, take with this. You have when the global health cluster is activated, when we respond as humanitarian organizations, as I said, we should be engaging with things like public health situation analysis. So there's that initial kind of response where we can sort of incorporate One Health into that piece of work as we engage as humanitarian organizations. I think on the other hand, in parallel to that, we should also be acknowledging the importance of One Health when we're communicating with our country offices and our teams as we go about our day-to-day work as humanitarian organizations. I think there's so many things that we work on where there is that capacity to acknowledge the One Health approach, but where perhaps we're not really doing so because we haven't been forced to do that yet. So I think, yeah, there's those two different aspects where we can utilize it and bring it in.
Great, thank you, Catherine. Well, I see that we're running out of time, so just want to thank you all. That was a really interesting hour. I wish we had more time to discuss everything. I want to thank all the speakers for their time. I want to thank Beatrice for her excellent job of doing the translation, and want to thank all of you participants for joining and for your great questions. I'd like to thank Ready and BHA for allowing us to host this webinar, and please do take a look at the Ready website if you haven't already. There's lots of useful information and operational tools on there. And if you have any questions about the webinar or for any of the speakers in the webinar, please do contact Ready via the email address in this chat box, and we'll get back to you as soon as we can. Thank you, everyone. That was great.